Hi, Dr. Michael Norman, Key West Spine and Injury, Key West's largest auto injury rehab clinic. Here today with our next coronavirus update. I want to talk today about some critical information on our immune system and how that impacts this whole coronavirus pandemic. Before I jump into that, I want to tell quickly though, we are open. So we continue. I'd like Dr. Makama's virus ninja idea, if you've seen his videos, or of course everyone's been watching Dr. Jack Norris's videos, and he talks about, he's of course one of the guys literally hunting the virus down in our community, but he also talks about how it's hunting him. And so between the two of those guys, I like the idea that we are continuing to be ninjas, and we've avoided being hunted down so far. So we've avoided exposure and we continue to be open, but again, with extreme precautions. We have a lot of screening in place where you're going to get your temperature taken. You're going to get a mask if you don't have one. We're going to teach you how to sanitize your hands properly. Everything, all of our equipment is going to be disinfected before you get here and after you leave. Everything with the screening process in place has allowed us to continue to be open. And so we see that as our mission in this whole pandemic is to be able to serve our community, take the burden off the emergency department, the urgent care centers, the PCPs, let them fight the fight of this coronavirus and let us do our job. Again, today we just got 2 new patients that were, and so we're going to continue to take care of them over the weekend. And so that, again, is what our job is. We see that as our mission to be able to take the burden off them and do what we do. So with that, let's jump into, like I said, what I want to talk about today is our immune system and what that got to do with this big coronavirus pandemic. This came about kind of surprisingly, personally for me. The last video, if you didn't see it, go back and watch it. I talked about exercise and its importance. I was even in the governor's orders that it was essential. And the reason that was a surprise for me is I talked to people this last week and did a lot of telemedicine, talking to people. People were, in essence, kind of like, Doc, what's this big deal about exercise? Why are you pushing exercise so much? And honestly, I was kind of taken aback. So some basics here. We're dealing with this coronavirus epidemic, and everyone's seen the news. It particularly affects the elderly. So some basics on our immune system. In youth, we have our highest immune system. As we age, our immune system declines. And so the elderly, because of that immune system, are more susceptible, not just to coronavirus, but they're more susceptible to colds and flus and pneumonia and cancer and heart disease. On and on, everything is going to affect elderly more impactfully in a more negative, worse outcomes because of that lowered immune system. So obviously enough, we can't reverse our age, we can't do anything with our age, but what can we do is no matter what age we are, boost our immune system. And so that's what I want to talk about. So the exercise, that came about with people, like I said, being surprised, and I was kind of like, whoa, this is kind of common sense here, guys. This COVID-19 is the name of the disease. The virus that causes COVID-19 is the family of SARS virus, severe acute respiratory syndrome. It's a respiratory, it affects our lungs, our breathing. The number one effect of exercise on our immune system just comes from the effect of breathing. When you breathe hard, you breathe deep, and so exercise flushes your lungs and your airways. It makes you less susceptible to colds and flus. So you're literally flushing with that deep breathing bacteria and viruses out of your body. So that's just, like I said, just kind of a common sense effect of exercise and why that is so important at any time throughout your life. You want to stay fit and keep your lungs working hard. It always keeps you flushing them out, but especially when the world's facing a pandemic which affects our lungs. All right, so again, I don't mean to be too obvious here, but this is really, like I said, almost common sense. Exercise is critical for our lung health. So number 1, exercise, critical for our immune system. Number 2 is nutrition. Now right off the bat, I'm talking to you out here in Facebook and YouTube land, so I can't talk specifically about your situation or your nutrition. So official medical disclaimer, this is not medical advice. Talk to your doctor, talk to your nutritionist. So what can I tell you there is what I'm doing for me and my family. So what I did several weeks ago, a couple months ago now, when this whole coronavirus got on the news, I went to Amazon and stocked up, loaded up on my nutrients. And so some supplements. Number 1, everyone's heard of this, of course, vitamin C. Normally I take 1 gram of vitamin C, help boost my immune system. The great thing about vitamin C is water soluble, so you don't have to worry about toxicity levels. You're gonna flush it out if you take more than you need. Right now, I'm taking 1.4 grams, 1,400 milligrams every night as part of my supplement routine. That's vitamin C. Vitamin C is this old one in the books. Everyone knows about that. The one that I really is kind of my pet peeve, when my kids start to get the sniffles or anybody's cold, we jump in and we mega dose on vitamin D3. So I know my patients out there, they're probably rolling their eyes like, oh no, here he goes again, is D3. So vitamin D3 is something I'm always harping on, and there's a reason for that. Research shows most Americans are deficient in vitamin D3. And so there is a test. So the next time you go in for your annual blood work, ask your doctor. The lab test is 25 OHD. 25 OHD. So ask, have your, and that's the serum blood level of your vitamin D3. So have your 25 OHD levels tested. A healthy amount is about 60 to 80 nanograms per milliliter. That's a nice healthy amount. And again, research shows most Americans are deficient. Well, that deficiency in D3 has been shown to be correlated with everything from heart disease to cancer to colds and flus. Lots of problems when we lower your immune system with those lower D3 levels. And so normally the bottle I take has got 4,000 IUs and a drop. And so normally I take, I'm doing this, I'm mimicking that, so we put it under our tongues. So I drop one drop, 4,000 IUs normally. Right now I've been doing 5 drops, about 20,000 IUs. So I'm mega dosing to a degree for a short term. You can do that. I said 60 to 80 is your normal healthy amount. It's not till over 150 does it become toxic. And so we do have a bit of a leeway there where we can mega dose for a period of time and not worry about that. So I'm taking mega doses in D3, get my immune system up. The other one I'm taking right now is zinc, about 50 milligrams of zinc every night. And so again, those are my immune boosters, my little mega doses I'm doing a little bit more than normal. The other one I want to talk about is vitamin A, but I don't supplement vitamin A. Vitamin A is critical for protecting your cells, but vitamin A is real easy to get if you're just eating healthy. As long as you're not eating a bunch of junk food and fast food, if you're eating taking vitamin A in enough with healthy food, green vegetables, spinach, carrots, sweet potatoes, eggs, liver, of course, is huge in vitamin A. What else? Salmon, tuna. So there's lots of ways to get a healthy. Mangoes is a fruit. So lots of ways to get vitamin A as long as you're eating a healthy diet. So I don't supplement vitamin A, but that's another part of this whole nutrition idea. All right, so we've got exercise and some nutritional tidbits on helping to boost our immune system. Now I want to be real clear. This is to help boost our immune system during this pandemic. That doesn't mean I don't want anyone out there saying, oh, Dr. Norman said if I took these vitamins, I exercise every day, I can throw a big party and forget. No, no, and no. That's not what I'm saying. Continue with our social distancing. We're doing a great job in our community. I've had a couple patients now that have gone up to Miami for different treatments and procedures, and I've heard firsthand from them that it's night and day. The social distancing we're doing here compared to the mainland. And of course, we're seeing the results of that. You see that it's been a much bigger issue out there than it is down here. So as a community, we're doing great. Keep up the good work. Wear the mask in public. Keep the distance. Keep home when you're out, when you're not exercising, when you're not going to the store, not going to the doctor. So continue the great job we're doing as a community. Keep up the good work. It is working. So these are other things, these exercise and nutrition tidbits to help your immune system are just that, they're extra boost. That doesn't mean stop all the good work we're doing with the social distancing. So that's it for today. If you have any questions, again, write them down below. If it's anything urgent, by all means, like if you've been in a crash, a scooter, bicycle injury, give us a call. That's what we do. Be happy to help you. And again, our deal, take the burden off our healthcare system as they fight the fight with COVID-19. All right, any questions? If not, again, our number, 305-453-6610. Give us a call if we can help you. If not, everybody stay safe. Keep up the good work. We're doing a great job. Our numbers are doing good. Let's keep it up. Again, Dr. Michael, Key West Spine and Injury, Key West's largest auto injury rehab clinic. Take care.